As we get older, medications are often prescribed to help support both age-related concerns as well as medical conditions. For example, diabetes, high blood pressure, COPD, and glaucoma. As a result, managing medications is a daily task for most older adults, and sometimes their caregivers too. People must know what medications they are on, what they look like, what they're for, and when to take them, and how to take them properly. Doctors, nurse practitioners, and pharmacists work closely with older adults and caregivers to ensure they are on the right medication to meet their needs and to help them manage their medications. While medication can be necessary, older adults are at greater risk of polypharmacy, which is the use of multiple drugs at the same time.
So polypharmacy is a term that we use to talk about patients who take too many medications. And so in older adults, 2/3 of patients take more than 5 medications, which is considered polypharmacy. And almost a third of patients take over 10 medications, which is just lots of medications on those patients. And the concern with that is that you start to get an increased risk of interactions or extra side effects, additive side effects. And so we really want to be looking at those cases and those people that are taking more than 5 medications to make sure that all of them are needed and all of them are safe for those patients when they're used together.
How many medications are older adults taking? In a recent study, it was found that 66% of older adults take more than 5 daily medications, while 27% take more than 10. For older adults, this can be a concern.
So as we get older, our bodies change. So as a result, the way we respond to medications and the way we clear medications, it changes. So for example, sleeping pills. Someone may be taking a sleeping pill for 30 years. However, over time, because of their body's ability to clear the medications is less, that sleeping pill can hang around a little bit more. Not only that, but we know that as you get older, we're more sensitive to certain medications, and as a result, that medication might start to interfere with how clear our thinking is.
Sometimes what happens is medications end up being prescribed for side effects related to other medications. So we can end up getting into what's known as a prescribing cascade. So more medications can be added to combat side effects of current medications. So that can be problematic.
Because older adults often see many healthcare providers that prescribe medications, it is important to keep an accurate list of all current medication, which is more difficult to get than you would think.
Unfortunately, those doctors don't have access to the most up-to-date lists necessarily. So sometimes a specialist you're seeing will start a medication thinking it's perfectly safe, but the list that they're working off of of the medications you take is actually an older version. And so there might be an interaction or some side effects that are additive with the new medication they're starting with an old one.
Some of the ways that we can prevent medication-related concerns as we get older is to make sure we have an up-to-date medication list, make sure that we understand why we're taking all of the medications, and ask questions if we're not sure. Make sure that you visit one pharmacy so that they can keep an accurate record of all of your medications rather than having prescriptions filled at multiple places. That helps with assessing for ongoing need of medications as well as screening for side effects and interactions.
When we think about medications, we often only think about the prescription pills, but we should also think about the inhalers, injections, drops, and sprays, as well as medicated ointments, creams, and patches we put on our skin. Dr. Joanne Ho says older adults and their caregivers need to look at all medications.
So what we often want to know about is, what is the patient taking? All the medications, not just the ones that are on the list, or not just the ones that are on the blister pack, but what about those over-the-counter medications? You know, are there any anti-inflammatory medications that may help with pain, and fever, but sometimes as we get older, we know it can cause a little bit more harm than good. We want to know about all the medications being taken. And when I say medications, I think I should also include all natural health products, all alcohol, smoking, and cannabis.
Regular checkups with your healthcare team and seeing the same pharmacist is a good way to make sure the medications you take are right for you. Sometimes it makes sense to deprescribe or stop medications when the risk may be more than the benefit.
The end goal is how can we help the patient achieve what they want? So I always start with, how can I help you? It doesn't always need to be medication. Sometimes it's pulling back medication. Sometimes it's encouraging what we call non-pharmacologic measures. So different ways of helping without adding medication. Sometimes it's exercise, making sure that person doesn't have sleep apnea, making sure that person is able to get out and be active from a physical but also a mind perspective.
The North Simcoe Muskoka Specialized Geriatric Services Program provides comprehensive care for older adults in the region. The SGS partners with Geri MedRisk, a team that specializes in optimizing the use of medications for seniors in the province of Ontario.